welcome to my channel, Novas TV. As you know, over the weeks I've been giving you a lot of videos, and today I'm here with another one. But today you can see that I'm not here alone. I have a friend and a health practitioner here with me, Felix. Felix, you're welcome to the show.
Oh, thank you.
Unfortunately, I cannot shake you because
I know.
coronavirus is everywhere, so we will have to, but even though our distance is not, the prescribed one, but at least we make sure that we sanitize our hands with the, alcohol.
We just did that.
We just did that, yeah, and also wash our hands under running water, and then we are here. So, Felix. This coronavirus thing, I don't know how you see it, but I see it not to be funny at all. I don't know. It looks like people are not even aware of the fact that there is something called coronavirus. Because I pass through town and then I see people, people doing things that they are not supposed to do. I don't know how you see it. Do you see it to be the way I am seeing it, or you also see it? How do you receive this particular coronavirus issue?
Oh well, first of all, thank you very much for at least involving me in this discussion. Talking about coronavirus, yes, I think I side with you in a way because we all live in Tamale and we see how people live and other things. Looking at the case or the condition from the world level down to Ghana as we have it today, you realize that there is a very massive loss of lives and then so much cases regarding this coronavirus pandemic. But looking at our country, Ghana, it seems to appear that some of our indigenous are ignorant of the fact that they need to prevent themselves from this pandemic. People are really taking it for granted. But indeed, I'm very scared because when it gets to our local level, the question is, do we have the technical team to handle the situation? Do we have the infrastructures to be able to contain the victims? That's just my worry as we speak now. Other countries, usually when things of this nature happen, we resort to personnel from other countries to come and then assist or help in combating such situations.
But this is
the case that those countries are also facing the same problem. They are also
battling the same problem.
So apparently their health professionals will also be, team up to be able to take care of their people. So that means we won't have any technical team coming down to Ghana to also help us. So the question is, are our medical team ready? Right now that we started recording cases, I'm told today, as it stands now, we're having 19 cases. I'm
even told it's even up to 20. On the worldometer, which records the cases of it's not yet updated there, but that is what I'm hearing. Maybe probably at the end of the day, we'll know whether it still stands at 19 or not. I must say that the numbers keep on rising each and every day. As we are speaking to you now, the total number of cases is 317,300. I don't know how to even pronounce that in figures.
Yeah, that's
317,300
cases.
Wow.
Worldwide.
And then total number of deaths, we have 13,642.
That is not a small number.
That is not a small number at all. And then those people that have recovered, we have 95,953. And on the chart, we still have China up there. We have Italy. And then Spain, we have USA, we have Germany, we have Iran, we have France, we have South Korea, we have Switzerland, we have UK. And wow. These countries, if you are looking at it, these are the countries, if you are talking about technological advancement in health, you cannot leave China out. Apparently. You cannot leave USA out.
Indeed, yes.
You cannot leave Spain out. Germany, you cannot leave them out. France. Yet, these are the countries that have recorded. For China, it is understandable because that is where it started from.
Sure.
But my worry is Italy. Italy, Friday recorded 627 deaths. Yesterday they recorded about 790 something deaths.
Wow.
today it's not yet out. I'm only praying and hoping that the numbers do not go very up today, for which I'm not even very sure. Now let me tell you some of the things that are happening in Italy. Now in Italy, the only thing that can send you out is when you are going to the supermarket to go and get food. Foodstuffs. And if you even get there, you have to observe a certain distance in between, 2 meters. And when one person enters the mall, no other person enters it until the person comes out. If the mall is even as big as Tamale, the person will have to go in and come out with time, of course, before the next person also goes in. Okay. And if they just find you roaming without any tangible reason, you are either going to jail 3 months or you are going to pay a fine. 3 to 12 months or you are going to pay a fine. I don't think this is a stage where we want
I don't think
Ghana to get to. But I don't know. Do you think the government is doing enough to combat this particular coronavirus?
Oh yes. First of all, I would like to commend the government because we have stages of how will I say controlling cases or diseases. We have the primary stage, the secondary, and the tertiary. So looking at Ghana, for example, before we heard about the cases, educations and other things were being given through our media stations, our TV, radio stations, and all that, trying to educate and creating our awareness to this pandemic so that we'll get ready and then prevent ourselves from it. But looking at things, it looks like we, the individuals, we are being recalcitrant or being ignorant of what they are trying to tell us, the preventive measures they are trying to let us incorporate so that we wouldn't get the worst of this case.
Some churches, they had to go and pick some pastors.
So you can imagine. So looking at the case of Italy, I want to believe strongly that they didn't observe their primary preventive measures. That's why from the beginning, that's why the numbers shoot up this way. And if Ghana were able to start up something like this, I think we, the individuals, we need to also do our best so that together we can combat or fight this pandemic.
Because health practitioners have also suggested that there should be mass testing for every Ghanaian in every corner. Do you think this is a good idea?
Yeah, it's a very good idea. At least when you do that, we're able to screen some number of people and be sure and safe that the virus hasn't spread to all borders of the countries and all that. And I don't even know. I'm not sure whether we have enough of this test kits.
That is the issue. If
to be able to screen the people.
If we want to screen, then what it means is that yesterday the president will say we've ordered about 50,000 test kits and some other protective clothing which will arrive soon. I'm using this word, soon. So I don't know how soon is the soon.
How soon is the soon? You know, Ghanaians, we are impatient.
Very serious.
The government speaks, we are hoping to see change.
But how soon is this particular soon? Aside the mass testing, others have also suggested that we might need a lot of health personnel like yourself and myself in order to combat the disease. If you go to a place like South Korea, like Italy, what they have done is they have fast track their final year students who were just about, let's say, 3 months, 4 months to completion. They have fast tracked, they've written their exams and they have completed them. And immediately they completed them, they pushed them into the various health facilities to help them fight against this corona disease. In Ghana here, you and myself completed school in 2017. And then we did our service or our rotation up to 2019. We are still in the house. So in Ghana here, we have people who are even in the house. So do you think it would be a good idea to push them now, to mechanize them now, to give them financial clearance now, so that they go to the forefront and also go and help in this coronavirus issue?
Yeah, I think it's a very nice idea because this is a clear indication for the government to look into that and to make sure that they post or they put a lot of health personnel into the field to combat this disease. Like you said, 2 badges, if I'm not mistaken, close to about 3 badges are in the house now, looking for a job or waiting for the government to clear them. Now that we have this situation coming, who are we supposed to resort to? And looking at the statistics or the number of personnel we have, we don't have enough staff who will be able to, how will I say, combat this pandemic. So I think it's a nice idea. The government should try and then post nurses into the field so that they can help combat this pandemic.
Yesterday, the president even said that he's considering the retired health personnel and retired health personnel and also new nurses, new lab technicians and all of that to be posted. So let's hope that this one materialize, and then we'll see the end results of that. And then there was this thing I saw today. I saw a post that said this. They said 2020 is the year of nurses. It wasn't a joke at all. I saw them with nose masks.
A joke.
And it looks like indeed it's not a joke at all. And then yesterday the president also said that he's closed all borders to whether by air, by sea, by whatever. Do you think it has taken the government so long to do this, or do you think it was just the right time for him to have done that?
They started on a very good note, but for this particular case, I think they delayed. They delayed in taking this decision. They should have locked these borders long time. When we started hearing the cases from Italy and China, the numbers shooting and all that, it should have been an indication for us to just close borders.
There was a Norwegian who came, and then we saw the pictures with the president and all of that, who at the end was diagnosed of having coronavirus. And the fact he was the second or the first part of the first 2 people to be diagnosed of coronavirus. So if they had closed the borders earlier, I don't think this would have happened. Now let's stream it down to Tamale, where you and myself we find ourselves. Tamale. I passed through town today. I still saw gatherings of more than 25, which the government said gatherings shouldn't be more than that. I still saw gatherings which under normal circumstance we are not supposed to have. Do you think we as a people are being recalcitrant in specifically Tamale here?
Yes, the president has spoken. And with all due respect, we expected all Ghanaians to abide by simple rules and regulations. The president has said, don't do this, don't do ABC, but you still find out that people are hiding doing certain things. And down in Tamale here, like we said, there are some places or some communities who are very recalcitrant in obeying these simple rules. And you know why? It's just because most of them don't still see the need. Or like they don't actually they don't feel how rampant or how pandemic this disease is. It's like most of them haven't been educated on it very well. So I think some of them I don't really have problem with it because they don't know. But we, the few ones
that
know, I think it's our core responsibility to be able to educate people of this, report cases of such individuals who fall victims.
Yes, there is something I've also noticed in Tamale here. Sometimes, we use a lot of motorbikes here. Sometimes you'll be riding, and then somebody will be in a yellow. For those of you who don't know why yellow, that's Bahamas Kambu. And the person will spit.
Oh.
You riding, it just comes straight to your face like that.
My friend, don't even talk about that. I've encountered so many cases.
And the only thing they will tell you is sorry. And I don't think sorry can delete
no.
the viruses that are in.
Exactly. You just be walking, the person will see you coming on. But just when you are just close to the person, you realize, I don't know whether their conscience is always pricking or telling them to do that act. Then you just see that they will turn and spit in there, and the wind will just blow it
into your face.
Then all they could say is sorry.
Wow.
So I think our people
it's
really need
time
education.
We educate
we
them.
have to set up. We need to educate our people on that.
Yes, and I've also heard a couple of songs by northern artists, or they don't like to be called northern artists, musicians who are from the northern region here,
okay,
who have used this coronavirus to compose a song, in the likes of Fancy Gadam, the likes of Didonzi, in the likes of Ataka, the rap, in the likes of loooking. I think one of them is featuring loooking on that, and there are a couple of them out there who are singing with these songs. Do you think the people, the songs, in the songs, I don't really understand Dagwani, but the bit I understand, it was much of education. Do you think the people will take it serious?
Well, yes, in a way, because these are northern musicians. For Fancy Gadam, for example, he has a lot of followers in Tamale. So if he's able to put up a piece like that in a song, trying to educate people, I think it's a nice idea, and I would like to commend him for that.
Yes.
And also, talking about the people understanding, my issue is, well, people might listen to the song, but will they pick the pieces in the song into practice? That would be
they
the
might
question.
just be interested in singing.
They might be interested that Fancy Gadam has released a song, let us listen. But the actual words or the content of the song, would they be able to put them into practice, trying to educate us on how to wash our hands, how to sanitize ourselves, cover our noses when sneezing and all that, do not shake and all that? Would people be able to carry out that?
I see.
That is the question now. And looking at our people here, they are very recalcitrant. And now, boiling it down to our, how will I say, our facilities, our health facilities we have. Right now, I'm just hearing rumors that there's a case confirmed at Damango. And this Damango case, I don't know how true it is, but rumors are still circulating that the case is now at the Tamale Teaching Hospital. How prepared is the hospital? I've been in the hospital for the past 3 days now, and looking at the conditions there, personally, I don't think the hospital.
It still looks usual.
It still looks usual. The only thing, preventive measure I saw was they checking your temperature when you are coming in. Every facility you enter, you check. They'll check your temperature before you go in. And also did a very good thing yesterday. I think they placed the position Veronica Bacchus at
all
vantage points, all corners. So that when you are entering, you can wash your hands with liquid soap and then under running water. Then you can enter. While you are entering, they will screen you, they will check your temperature and that before you enter, so that they make sure that you don't contract any infection. Yes. So I think we still need a lot of education. As I said, we are indeed not prepared adequately per my discretion, per my own analysis, because the prerequisite skills are not there.
I saw a post by Chris Waddle. He said that he posted that if you are in Tema, just hook up and then he will give you hand sanitizer. And somebody from Tamale said, when is he getting his own? That Fancy Gadam will take care of that.
I think I saw that.
Somebody also posted that Fancy Gadam, I hope he heard Waddle. He reposted the picture and said that if you don't give us sanitizers, you cannot fill the stadium again because everybody will be dead. But so I think on that note, those musicians who at least you have something in your hands, at least you've played shows over the years, you've had money, you've taken monies from people for attending your shows. I think this is the time for you to also do something small. At least if you are even able to purchase 100 sanitizers and then you give it for free to those that cannot afford it, I think that would be a way. Because if at the end you have everybody being infected and then the worst happening, then you have no shows to play and all of that. But before we even leave, let's try and elaborate or just give more education on some of the precautionary measures that have been put in place, or some of the things you can do in order to prevent yourself from contracting the coronavirus.
Okay, we have given a whole lot of rundown on this corona pandemic. Now, what are some of the preventive measures that we ourselves can adapt so that we can at least prevent this pandemic? One, we are saying that do not shake hands or do not come into contact with someone or a friend, when you are to shake or greet, just greet with a bit of distance.
You can just do this.
Yes, you can just raise your hands.
And that's it. Like how the deaf and dumb.
I learned there's a way some corona greetings has come. You use your hand, your elbow like this and give the person. But I think don't just even come into contact with the person. That is what we think. And then 2, constantly wash your hands under running water. Constantly
with soap.
Even if you haven't come into contact with anything, and you see that you have spent like 2 hours, 3 hours, or even an hour, please wash your hands under running and be safe. And in the likes where you don't have running water at that moment, there's sanitizers. You can use sanitizers and also sanitize our hands. That one too will help kill the bacteria and all that. So my brother-in-laws here will complete the rest.
Of course, we also have to change our way of our behavior. Spitting when you're on your motorbike and you're riding, to just spitting anyhow. I think we will also have to stop that. And of course, he made mention of it's just personal hygiene. Once you take care of this personal hygiene, you adhere to this personal hygiene methods, then at least you have some chance of moving away from coronavirus. So these are some of the things you need to do. I think
gatherings.
Yes, the gatherings too. As I was saying, in town I still saw people gathered and all of that. Some people today cannot talk to you without hitting you or without placing their hands on you. Please, if you are that kind of people, just try as much as this time around. It's not advisable. And last but not the least, you don't need to be touching your face. I know it's very difficult. Since we started, I don't know how many times I've even touched my face with my own hands, but anytime it comes into my mind, then I just put my hands down. Okay. All right. So before we even take a leave of you, I would allow my brother here. He understands the Dagbani language, so that he'll just give a rundown in just some few seconds about what we've discussed about, and most importantly, the precautionary measure. So Felix, just try and then revamp this whole thing in Dagbani, so that our brothers and sisters out there who are watching and only understand Dagbani.
Well, I'll try my best.
You try your best.
I'm also Tepaya, Tepoya, Pom.
All right, Tepaya, Tepoya.
Yeah, I know. You see that I've tried it.
You've tried.
Yes,
Okay, so if you are new to this channel, this is North Bars TV. Make sure you subscribe to our YouTube channel, like our Facebook page. You can find us also on Instagram. Just like our pages for all updates. From now till every day, we'll be giving you updates. Every day or every 2 days or every week, we'll be giving you updates on this coronavirus issue. If you're also out there and then you want to be logged onto this particular channel, of course you can find the numbers rolling down. You can also pick the numbers and then just give us a shout out, and then of course we'll link up with you anywhere you are so that we get interactive. But the interactive, I'll allow some space to be in between us because coronavirus is real. It's very real. So just follow us on all our social media handles, and then of course let's get interactive. If for any sponsorships and for any partnerships, you can pick the numbers that are rolling. Just give us a call, and of course we'll be there with you, and then we'll see how we can strike deals and then keep this channel going and going and going till we hit the axim. So until we meet again next time, Felix, thank you very much for joining me once again.
It was very nice.
This is our studio. He's here today, and I hope you pass through.
Oh yes.
You'll be passing through regular so that we can do this again and again and again. Until we meet again, same time. God be with you.
Bye.